Congratulations on selecting GE's PandaWarmer for your labor and delivery area. The PandaWarmer lets you deliver healing warmth to your patients, helping to keep your healthy baby healthy. In order to get the best results for your little patients, it's important to be familiar with all of the PandaWarmer components and features, as well as their operation. Let's get started. First, make sure your PandaWarmer is plugged in and the auxiliary power switch is on. To power up the PandaWarmer, simply press the on-off switch on the front. The control panel will light up immediately. The recessed heater head and observational lighting are at the top. The aimable procedure light is conveniently located just below. The integrated full-color control panel is located in the center section. This PandaWarmer also features an optional resuscitation package. The dovetail rail system is located along either side. The unique rail system allows you to easily install shelves, IV poles, and other accessories. The bed has easy-to-open panels on 3 sides. The side and front panels hinge downward, keeping them out of the way during interventions. The panels can be easily removed for cleaning. The rear panel can be removed with the press of a button. The bed tilt handle lets you gently position the infant for treatment. It tilts forward and backward plus or minus 12 degrees. The recessed handle location protects against accidental bed movement. To return the bed to a level position, for example, to weigh the baby or perform an X-ray, a side level indicator located on either side panel lets you know that the bed is level. An optional elevating base is operated using a foot pedal. The bed moves smoothly and quietly to a comfortable position for the caregiver and family. Pass-through drawers on either side keep supplies at your fingertips. Foot-operated wheel locks keep the PandaWarmer stationary when in use. Handles on the front and back let you move the PandaWarmer smoothly and effortlessly. Let's locate the components. Warm-up mode starts immediately upon power on. It lasts for 7 minutes with heater output of 100%. After 7 minutes, heater output drops to 50%. There are no alarms in warm-up mode. Do not place the baby on the bed during warm-up mode. To stop warm-up mode and begin normal operation of the PandaWarmer, you can press either the Admit Baby key or the APGAR On-Off key. Pressing the APGAR On-Off key starts an automatic timer. The PandaWarmer begins normal operation in manual mode at 100% power. We'll discuss the APGAR function in a later section. Pressing the Admit Baby key brings the PandaWarmer to normal operation in manual mode at 100% power. Confirm or adjust the heater power setting by pressing the up or down arrows. In manual mode, you will see manual mode highlighted in blue on the control display. Manual mode controls the heater output according to a heater power percentage set by the user. All patient alarms are active in manual mode. Upon entering manual mode, you will be asked to confirm heater power by pressing either the up or down arrow keys. The PandaWarmer is preset so that the check baby alarm is disabled when you select a heater power setting of 25% or below. This may be adjusted at your hospital. Please verify the setting with your manager. In the baby mode, the warmer controls heater output to a desired baby set temperature you enter. Heater output is based on measured differences between the set temperature and the skin probe temperature reading. To place the temperature probe on the baby, first insert the temperature probe into the probe jack connection on the side. Make sure the baby's skin is clean and dry before applying the probe. To attach the disposable probe, peel the paper backing from the adhesive side and apply to the baby's skin with the reflective foil side up. To attach the reusable probe, use a heat-reflecting patch. Peel the paper backing from the adhesive side of the patch and place the patch over the probe with the reflective foil side up. Place the metal side of the probe against the baby's skin at a site consistent with your unit's policy and procedures. The probe must be directly in the path of the radiant heat. The baby's temperature will be displayed in green above the power setting. To move into baby mode, push the key next to the highlighted screen area. The screen will now highlight baby mode in blue. Upon entering baby mode, you will be asked to set the set temperature using the up and down arrows. Set temperatures may be adjusted between 34 and 37.5 degrees Celsius. GE recommends using the PandaWarmer in baby mode, where the heater output is regulated based upon the difference between the baby's set temperature and the baby's actual skin temperature. PandaWarmers are designed to optimize warming therapy for newborns. The PandaWarmer uses radiant heat to quickly warm the bed surface so that it is ready when the baby arrives. During the first moments of life, the PandaWarmer provides soothing warmth while you care for the infant. The recessed heater does away with the awkward overhead heating unit. The unique design improves visibility and makes it easier for you to interact with the baby. Heat travels from the dish to the bed, completely covering the bed surface with radiant warmth. The radiant heat follows an hourglass-shaped pattern. We call this the hourglass heat profile. This unique radiant pattern quickly and uniformly warms the bed surface while keeping the caregiver cool and comfortable. The PandaWarmer has 3 operational modes: warm-up mode, manual mode, and baby mode. The PandaWarmer's control panel can be accessed without disturbing the baby. The bright display is easy to read, even from across the room. The PandaWarmer has 2 alarm priorities. One is a low priority alarm, and the other a high priority alarm. A red text message indicator on the control screen, a blinking red light, and an intermittent tone indicates a low priority alarm. A high priority alarm has the same control text message and blinking red light. The difference is that the audio tone is continuous. To silence the alarm, press the yellow key at the top of the control panel. When you silence an alarm, the text message gets smaller and moves to the top of the screen. The light goes from blinking to solid. When the alarms have been silenced, the audio tone is temporarily turned off, but the warmer remains in alarm status until the alarm condition clears. The audio tone will resume when the silence period expires, which varies with the alarm type. If there are multiple alarms, the text messages alternate every 2 seconds. Your PandaWarmer has a new way to silence alarms. We call it hands-free alarm silence. The motion sensor for the hands-free alarm silence is located in the alarm light panel. Silencing an alarm with the hands-free alarm silence works exactly the same as pressing the alarm silence key for all alarms. Silence the alarm by gently waving your hand approximately 2 to 6 inches in front of the sensor. Using the hands-free alarm silence will allow you to silence alarms without touching a surface during a procedure or intervention. PandaWarmers are designed with 2 advanced lighting options to give clinicians the right amount of light when and where you need it. A knob on the control panel precisely adjusts the dimmable observation light. The light can be adjusted to the most desirable setting for the clinical staff. When performing a procedure, you often need extra light. Use the aimable procedure light to focus on the procedure area without exposing the baby to excess light. The procedure light has an on-off switch located on the handle for easy activation. The APGAR timer can be activated during all 3 operational modes. In warm-up mode, activating the APGAR timer takes the bed out of warm-up mode into normal operation in manual mode. Confirm the heater power setting by pressing the up or down arrows. When activated, elapsed time is shown on the screen. A tone sounds to alert you to the APGAR score in 1 minute, 5 minutes, 10 minutes, and every 5 minutes after that. A visual flag on the screen also alerts you to the 1, 5, and 10-minute APGAR time. Panda warmers are available with an optional integrated resuscitation system, helping to make all the necessary equipment for neonatal resuscitation available at the bedside. Setup for the T-piece resuscitation unit begins at the back of the unit by attaching the gas supply. If you would like to use a tank gas source, ready the tank by removing any manufacturer's packaging, but do not remove the gaskets supplied with the tank. Insert the tank into the tank holder. Lift and seat the tank in the yoke on the back of the resuscitation system. Make sure the gasket is properly placed and tighten the yoke. The tank is now firmly connected at the yoke. Repeat the process for the second tank. The integrated high-pressure yokes are only available when you purchase the integrated blender option. Open tank valves slowly to avoid damaging the regulators. Use the tank wrench to slowly turn the valve counterclockwise and verify that the tank contains an adequate supply of gas by examining pressure on the gauge on the front panel of the resuscitation system. Repeat the process for the second tank. Attach the wall source hose connectors to the indexed inlet ports on the back of the unit. To begin your checkout of the resuscitation system, first check the tank gauges on the front panel. Ensure that the tanks are open and that you have adequate gas supply. Next, perform the checkout procedure for the suction. Check that a clean suction canister is properly installed and attached to the tubing in the dovetail rail. Attach desired length of suction tubing to the suction canister. Turn the suction control switch on. Occlude the connective tubing, then adjust the suction control knob to a desired pressure between 60 to 120 millimeters of mercury. Once you have set the desired vacuum level, attach the suction catheter or meconium aspirator of your choice. Turn the suction control switch off until ready to initiate resuscitation or airway support measures to avoid wasting gas. Suction tubing between the canister and the patient should be changed with every patient. Next, you will need to check out the T-piece resuscitation gas delivery system. First, turn the medical gas switch to on. Attach oxygen tubing for free-flow oxygen to the left gas outlet on the front panel of the resuscitation system. Turn the flow meter control knob above the free-flow oxygen tubing to a desired flow rate between 5 and 15 liters per minute. 10 liters per minute is effective in most cases. Next, connect the T-piece circuit to the T-piece gas outlet on the front panel. Now turn the flow meter control knob above the T-piece gas outlet to a desired flow rate between 5 and 15 liters per minute. 10 liters per minute is effective in most cases. To check maximum inspiratory pressure, occlude the PEEP control knob on the T-piece circuit and turn the PIP control knob on the front panel fully clockwise beyond the yellow override release. Verify that 45 centimeters of water pressure can be obtained plus or minus 10% on the airway pressure manometer. While keeping the PEEP control knob on the circuit occluded, turn the PIP control knob on the front panel counterclockwise to set the desired PIP level. To adjust the PEEP, remove your finger from the PEEP control knob and rotate the PEEP control knob to set the desired level. 0 to 5 centimeters water is recommended by NRP 5th edition. For units with a blender, adjust the blender control knob to set the desired FiO2 from 21% to 100%. Perform a few practice breaths by using your thumb or index finger to occlude the PEEP control knob. Watch as the manometer gauge shows your PIP and PEEP. Remove the blue end cap and attach a neonatal face mask. Turn the medical gas switch off until ready to initiate resuscitation or airway support measures. Use only GE Healthcare T-piece patient circuits. When it comes to infant resuscitation, time is as precious as your patience. Split-second preparation, accurate assessment, and rapid response are necessary to help achieve positive outcomes. Immediate access to all the right tools and equipment is absolutely essential. With the integrated T-piece resuscitation system, you have everything you need right where you need it to quickly and safely deliver neonatal resuscitation therapy to your precious high-risk newborns. Setup for the bag and mask resuscitation unit begins at the back of the unit by attaching the gas supply. If you would like to use a tank gas source, ready the tank by removing any manufacturer's packaging, but do not remove the gaskets supplied with the tank. Insert the tank into the tank holder. Lift and seat the tank in the yoke on the back of the resuscitation system. Make sure the gasket is properly placed and tighten the yoke. The tank is now firmly connected at the yoke. Repeat the process for the second tank. The integrated high-pressure yokes are only available when you purchase the integrated blender option. Open tank valves slowly to avoid damaging the regulators. Use the tank wrench to slowly turn the valve counterclockwise and verify that the tank contains an adequate supply of gas by examining pressure on the gauge on the front panel of the resuscitation system. Repeat the process for the second tank. Attach the wall source hose connectors to the indexed inlet ports on the back of the unit. To begin your checkout of the resuscitation system, first check the tank gauges on the front panel. Ensure that the tanks are open and that you have adequate gas supply. Next, perform the checkout procedure for the suction. Check that a clean suction canister is properly installed and attached to the tubing in the dovetail rail. Attach desired length of suction tubing to the suction canister. Turn the suction control switch on. Occlude the connective tubing, then adjust the suction control knob to a desired pressure between 60 to 120 millimeters of mercury. Once you have set the desired vacuum level, attach the suction catheter or meconium aspirator of your choice. Turn the suction control switch off until ready to initiate resuscitation or airway support measures to avoid wasting gas. Suction tubing between the canister and the patient should be changed with every patient. Next, you will need to check out the bag and mask gas delivery system. Turn the medical gas switch on. Attach oxygen connecting tubing for free flow oxygen to the left gas outlet on the front panel of the resuscitation system. And adjust the flow meter control knob above the outlet to a desired flow rate between 5 and 15 liters per minute. 10 liters per minute is effective in most cases. For units with a blender, adjust the blender control knob to set the desired FiO2 from 21% to 100%. Connect the pressure tubing from the resuscitator to the pressure manometer connector on the front of the resuscitation system. You may omit this step if you are using a manual resuscitator with an integrated manometer. Use oxygen tubing to connect either a self-inflating or flow-inflating manual resuscitator to the right gas outlet on the front panel of the resuscitation system. Adjust the flow meter control knob above the outlet to a desired flow rate between 5 and 15 liters per minute. 10 liters per minute is effective in most cases. Follow hospital, regional, or national guidelines for setup of your manual resuscitator. Common steps might be to occlude the patient connection port or face mask of the manual resuscitator and set PEEP and PIP on the manual resuscitator. PIP and PEEP may be adjusted by changing the flow rate using the flow meter control knob on the front panel of the resuscitation system. It may also be adjusted using the PEEP valve on the manual resuscitator, depending on the type of resuscitator system that is connected. Turn the medical gas switch off until ready to initiate resuscitation or airway support measures. When it comes to infant resuscitation, time is as precious as your patience. Split-second preparation, accurate assessment, and rapid response are necessary to help achieve positive outcomes. Immediate access to all the right tools and equipment is absolutely essential. With the integrated bag and mask resuscitation system, you have everything you need right where you need it to quickly and safely deliver neonatal resuscitation therapy to your precious, high-risk newborns. An integrated in-bed scale lets you conveniently weigh the baby and display the baby's weight on the control panel. Every baby is weighed at birth, and our integrated in-bed scale option simplifies the weighing procedure while keeping the baby warm in the process. Ensure that the scale is properly connected to the probe jack panel. The baby should be in approximately the center of the bed. Clinical equipment such as resuscitation bags or artificial airways should not rest against the side of the bed. Blankets may be tucked under the mattress, but must not be tucked under the weighing platform. To begin, press the menu key, then press Scale. If the scale is not connected, no icon will appear. To weigh the baby, press Weigh. You will first be prompted to check the side level to ensure the bed is level during weighing. Next, you will be prompted to lift the baby. This allows the scale to zero. If an object such as a laryngoscope is on the bed, it will zero out when the baby is lifted. Leave these objects on the bed throughout the procedure. Objects attached to the baby such as IV tubing or ventilator tubing should be suspended or held above the mattress when you replace the baby. When prompted, replace the baby on the bed, and the weight will be displayed. You may toggle from grams to ounces. After you have finished weighing the baby, two new menu choices appear. You have the option to double-check the weight using the reweigh feature. The reweigh feature allows you to verify the weight value without lifting the baby a second time. This feature is only available for 5 minutes after the last weight. Choosing Last Weight will display the most recent weight value. Fully integrated SpO2 monitoring on the PandaWarmer supports NRP and other local or regional resuscitation guidelines. It allows you to measure oxygen saturation and pulse rate from the time of birth and during resuscitation. To set up the SpO2 feature, first plug the probe cable into the panel on the left. Next, attach the SpO2 probe to the baby, referring to the manufacturer's instructions for placement of the SpO2 probe. The readings will automatically start when the probe is attached to the baby. PandaWarmers have advanced trending capabilities to help you plan and execute infant care. It's simple to change the setup parameters for the PandaWarmer. The setup menu lets you do it with the touch of a button. First, press the menu key, and then press Setup. Pressing the temperature units key lets you change the measurement units from the default Celsius to Fahrenheit. Alarm volume lets you set the tone lower from the high volume default, choosing whatever is appropriate for the patient and physical layout of the L&D unit. When capturing SpO2 measurements, the pulse tone volume can be activated and the volume adjusted or set to off. You can also change the clock setting if you need to. Touching the Next key brings up a new group of options. The Elevate and Hands-Free Alarm Silence keys allow you to enable or disable those features. Push the Patient Temp Alarm key to choose between two settings in the PandaWarmer's baby mode, 0.5 or 1 degree Celsius. When your baby's skin temperature exceeds the set temperature by greater than plus or minus 0.5 degrees Celsius or plus or minus 1 degree Celsius, you will receive a baby hot or baby cold alarm. The manual temperature alarm is a safety feature that allows you to monitor the baby's temperature in manual mode with a skin temperature probe, and provides you with the safety of an alarm should the baby's temperature reach a range of clinical concern. To set the manual temperature alarm, attach a skin temperature probe to the baby. Push the manual temperature alarm key to choose from three settings in the PandaWarmer's manual mode: off, 0.5 or 1 degree Celsius. Change the temperature control mode temporarily from manual mode to baby mode and enter a set temp. This will serve as your desired notification parameter. Return to manual mode. Confirm the heater power. When the baby's skin temperature exceeds the value you entered by greater than plus or minus 0.5 degrees Celsius or plus or minus 1 degree Celsius, you will receive a baby hot or baby cold alarm. Labor and delivery is a busy place. We've made getting a PandaWarmer ready for the next patient a quick and easy process. First, adjust the elevating base to a comfortable position. Turn off the power at the standby power switch and unplug it from the power source. Move the PandaWarmer to the cleaning area. If the bed is warm, allow it to cool for 30 minutes. While it's cooling, remove ancillary equipment and empty the drawers. Remove the east and west or left and right side panels. Remove the south panel at the foot of the bed and remove the north panel at the head of the bed. Remove the mattress, the plexiglass plate, and the scale. If your bed has an X-ray tray, remove it by sliding it all the way out of the bed platform. Refer to the Warmer O&M manual for recommended cleaning solutions and wipe down the surfaces of the warmer with a soft cloth dampened with a recommended cleaning solution. Do not spray cleaning solution into the heater head dish. Do not spray cleaning solution or other liquids into the vents on the back of the heater housing. This can damage electronics inside the unit. Clean using a damp cloth only. Reinstall the disinfected components in the reverse order of removal. Reinstall the scale. Then the plexiglass plate and the mattress. After disinfecting and drying the surface of each of the bedside panels, replace the north, south, east, and west panels. Clean ancillary equipment and reattach. Wipe down the control panel with a damp cloth. Plug the PandaWarmer into the power outlet and prepare the PandaWarmer for the next admission. GE Healthcare's PandaWarmers give newborns a warm welcome into the world. They're designed to give you complete thermal control anywhere across the labor and delivery environment. It's better for the baby and easier for you.